Moving on, viewers, there's another health concern that is now lurking across India with 7 new cases of HMPV being recorded. Measures have been stepped up across the state because the central government has made it very, very clear to step up protocols and also ensure that precautionary measures are also in place. So far, 7 cases have been registered across India. And to give us more insights on this, we have Dr. Sanjeev Bagai, Chairman of Nephron Clinic, joining us live this morning. A very good morning to you, Dr. Bagai. 7 cases have been recorded across the country. Should people be worried?
I don't think, good morning, I don't think people should be worried, but it's a wake-up call, again, that we need to take personal hygiene and care with regards to respiratory infections. This is, again, an RNA virus. It is not new. It's been in existence worldwide after its isolation almost 25 years back. Luckily for us, even though being an RNA virus, it hasn't mutated very rapidly. Its infectivity is low. The virulence of the strain is low, and it doesn't have the bad proteins what COVID had. So from that point of view, it is a milder infections, mild cold, cough, fever, little bit of rash, maybe a sore throat, sneezing, wheezing. Bronchitis and pneumonia are although rare, hospitalization is even rarer, and the death rate is very low. So there is no fear from that point of view, but I think we need to keep an alarm that any cold, cough, fever, rash, breathlessness should be warranted to be seen by a doctor. There is no vaccine available for it as at the present moment, and neither one is required. And there are no antivirals which have been recommended for this. This symptomatic treatment, hand hygiene, adults must wear a mask, avoid crowded places. Winter months, we always see a surge of respiratory infections.
Dr. Bagai, during COVID, people developed their immunity. Now the immunity is much stronger than it was before the COVID era. So do you think that, this immunity would probably be a fillip for us to battle this HMPV outbreak?
Yes, so COVID, although COVID was caused by SARS-CoV-2, which is again an RNA virus, that is entirely different as a spectrum. The genomic code of that is very different. This, like I mentioned, luckily doesn't have the bad proteins, what we call as NSP1 and NSP2, which interfere with the immune system through the interferon pathway. So it doesn't damage the body as much as what SARS-CoV-2 did. Most of the infants are infected between the age groups of 6 months to 12 months. Almost all human beings would have been exposed to this virus during the course of their early adulthood. So we develop a natural immunity. We will develop natural neutralizing antibodies towards this infection. And over a period of time, the body gets immune to it. So the body responds well. We'll need to look after our personal hygiene, especially people who are above the age of 65, who have asthma or chronic obstructive lung disease or any immunocompromised status, need to be careful. Avoid, like I said, crowded places, very polluted environments, sudden temperature change, exposure to extreme cold, poorly ventilated places. And again, the importance of mask is so overwhelmingly important.
Right, Dr. Bagai, many thanks for joining me with those insights. Well, there you heard it. Personal hygiene must be prioritized once again. Mask up whenever you're stepping out, avoid crowded places, and also ensure that you take utmost precautions and report any symptom to your doctor. But with fresh cases now coming to light from Nagpur, the total tally of HMPV cases has risen to 7 across the nation, sparking concerns. And also now, the centre has asked the state governments to monitor the situation and ramp up surveillance. So precautionary measures are also in place. Here's a report on the latest coming in.
India's HMPV tally has risen to 7, with 2 new cases reported in Nagpur. This comes after Monday's report of 2 cases in Bengaluru and 1 each in Ahmedabad, Chennai and Salem.
ह्यूमन मेटान्यूमोवायरस जो है ये जैसे बाकी आपके वायरसेस हैं, एडिनो वायरस है या आपका ये कोविड वायरस था, ऐसे ये भी एक वायरस है। तो हमारे जो प्रशासनिक तैयारियां हैं इस सिलसिले में, तो कोविड के टाइम से लेके जो ऑगमेंटेशन हमारा इंफ्रास्ट्रक्चर का हुआ था उसको हमने मेंटेन करके रखा हुआ है, जिनमें आपके ओजीपीज हैं, आपके ऑक्सीजन सिलेंडर्स हैं, कंसंट्रेटर्स हैं, बाकी लॉजिस्टिक्स हैं, पीपीई किट्स हैं। तो उस हिसाब से हमारी तैयारी जो है किसी भी इन्फेक्शन से लड़ने के लिए हमारी तैयारी पूरी है। हमारी रेगुलर सर्विलेंस जो है वो चलती रहती है। ILI हम बोलते हैं, एक्यूट रेस्पिरेटरी इलनेस केसेस जो हमारे आते हैं उनकी लाइन लिस्टिंग की जाती है और हमारे पास उसकी रिपोर्ट आती है। इसमें जो भी अगर कहीं सर्ज होती है, केसेस ज़्यादा आते हैं या एक्सट्रीम एजेस केसेस जो इन्वॉल्वमेंट होती है, ब्रोंकोनिमोनिया किसी का होता है, या तो उसमें हम ज़्यादा प्रिकॉशन लेते हैं, उनको हम डिटेक्ट कर लेते हैं। जो हमारे स्टैंडर्ड ऑपरेटिंग प्रोसीजर है उसके हिसाब से उन पेशेंट्स को आइसोलेट किया जाता है। आइसोलेट करने के बाद उनके जो डिफरेंट टेस्ट हैं, एक्सरे टेस्ट हो गया, ब्लड टेस्ट हो गया, CB नेट हो गया, ये करवाए जाते हैं और उसमें हम डिटेक्ट करते हैं।
The centre has advised states to increase surveillance for respiratory illnesses and spread awareness about preventing the HMPV transmission.
Increase, so-called reported increase in cases in China have been analysed and studied by the Joint Monitoring Group, Government of India, and their analysis is that there is no unnatural increase in such cases. Second thing which they have said is that these are due to multiple viruses which are usually found in this season.
The BJP in Karnataka has urged the state government to take HMPV seriously, citing its devastating impact in China. Leader of opposition R. Ashok has called for an immediate assessment of oxygen availability and ICU beds in government hospitals, following the detection of 2 HMPV positive children in Bengaluru. The health minister has reassured the public, stating that HMPV is not a new virus and poses no new threat, having been first identified all the way back in 2001.